Welcome to the Vaccines for Children program webinar for today, July 16. Our monthly webinar will be on the 2024-2025 influenza season, and it's being presented by Lorraine Lim, one of our RN quality assurance assessors with the Hawaii Department of Health Immunization Branch. Next slide, please. Just a few housekeeping rules. Please ensure you're muted throughout the presentation unless you're speaking. And reminder for the QA team, please monitor the chat for questions you may be able to answer. And any attendees, today's session is being recorded. Slides and webinar recordings will be uploaded to the Hawaii VFC program website listed there, and to be added to the Hawaii VFC program email list, please email your request to hawaiivfc@doh.hawaii.gov, and in the subject line of the email, please write email list. Next slide, please. For any questions during today's webinar, please use the chat to ask your questions so that the Hawaii VFC program subject matter experts can respond directly, and we'll be answering your questions at the end of the presentation. Now I'm going to turn it over to Lorraine, our presenter for today.
Next slide, please. So for today's objectives, by the end of the presentation, providers are able to identify where to access Hawaii-specific influenza trends, learn about the 2024-25 Trivalent influenza vaccine, and understand VFC influenza vaccine pre-booking, ordering, and borrowing guidance. Next slide, please. Each year, CDC estimates the burden of influenza in the United States. Next slide, please. The estimates provided in this slide are the last update to the preliminary in-season disease burden estimates for the 2023-2024 season, unless there is a shift in activity during the summertime. So from October 1st of last year through June 15, 2024, there have been 35 to 65 million flu illnesses, 390,000 to 830,000 flu hospitalizations, 16 to 30 million flu medical visits, and 25,000 to 72,000 flu deaths. Reporting of the preliminary in-season burden estimates for the 2024-2025 season will begin again in fall 2024. Because the flu surveillance does not capture all cases of flu that occur in the United States, and the CDC provides these estimated ranges to better reflect the larger burden of flu. So these estimates are calculated based on data collected through CDC's Influenza Hospitalization Surveillance Network. Please visit the link provided below for more details. Next slide, please. The new Hawaii Respiratory Disease Dashboard that was developed by the DOH Disease Outbreak Control Division, or DOCD, provides an at-a-glance snapshot of current respiratory disease activity statewide. So respiratory diseases occur year-round in Hawaii. So the dashboard captures disease activity trends for COVID-19, influenza, RSV, and other acute respiratory illnesses. To access the current and combined weekly influenza and respiratory surveillance reports, you can click on the Hawaii Influenza Activity Report link under the Additional Resources for Influenza. The data in this report reflect the 2023-2024 influenza season, which began the week ending October 7, 2023, that is week 40, and will end the week ending on September 28, 2024, which is week 39. This report is being updated every Friday. So all the links are below if you want to access it. Next slide, please. So the charts you see here are taken from the Influenza and Respiratory Surveillance Report for week 26, which is from June 23 to June 29, 2024, and it indicates the population-based rate for positive influenza cases in Hawaii by age group for the 2023-2024 influenza season. So although all children younger than 5 years old are considered at higher risk for serious flu complications, the highest risk is for those younger than 2 years old. So as you can see, this is evident in the orange chart on your right, which is the cumulative flu positive rate for the flu season we're currently in. Next slide, please. So in this chart, the line you see in red is the current season, and on week 26, influenza cases appears to be on a steady decline and may have already reached a peak, which you can see at week 52, which is from December 24 to 30, 2023. Seasonal influenza viruses circulate in Hawaii year-round, but most common during the fall and winter months. The exact timing and duration of each flu season varies from year to year, but influenza activity usually begins to increase during October. Next slide, please. So I included information on avian flu. The Hawaii Department of Health issued a statement last week, July 11, that the state and federal agencies are keeping a close eye on the H5N1, the influenza A strain associated with highly pathogenic avian influenza, or HPAI. Please refer to this link to read more about the news release. Next slide, please. So what do you need to know about avian flu? H5N1 bird flu virus has been circulating worldwide and has been causing outbreaks in poultry and dairy cows in the United States. And a few human cases have occurred in 2024 following exposure to infected animals. The current risk to the general public in Hawaii is low. And at present, Hawaii is the only U.S. state in which the H5N1 influenza has not been detected, and the state and federal agencies are working to keep it that way. Residents are encouraged to report sick or dead birds, especially when multiple birds are affected to Hawaii Department of Agriculture. Their numbers and hours of operations are stated in there. And Hawaii residents who recently visited or worked on a farm in another state with known or suspected H5N1 animal infections should contact the Hawaii Department of Health's disease reporting line at this number for a telephone risk assessment. Now, the following measures can reduce the risk of being infected with avian flu. So do not touch sick or dead birds. Do not drink raw milk. Pasteurization kills H5N1 virus, and pasteurized milk is safe to drink. When in direct or close contact within 6 feet of sick or dead animals with suspected or confirmed avian influenza, or the feces, litter, raw milk, or contaminated materials, where appropriate, CDC recommended PPE. So further details is on the link below. If you become sick due to direct contact with sick or dead animals with suspected or confirmed avian influenza, isolate from family and stay home until you are proven not to have bird flu virus infection. Influenza antiviral chemoprophylaxis can be prescribed by healthcare providers to persons exposed to avian flu. So more details is on the link. Next slide, please. So out of the influenza viruses, the two types that we see infecting humans most often are influenza A and B. They are the types that causes seasonal outbreaks, referring to as seasonal influenza viruses. Next slide, please. Flu virus are constantly changing, and they can change in two different ways. Um, but first, let's talk about influenza A and B. So influenza A viral strains are classified into subtypes based on two surface proteins, which is the hemagglutinin, or HA, and uraminidase, which is NA. And influenza A viruses that have caused widespread human disease over the decades are the three subtypes of HA, which is H1 and H2 and H3, and two subtypes of NA, which is the N1 and N2. For influenza B, viral strains have evolved into two lineages, which is the B Yamagata and B Victoria. So one way flu viruses change is called antigenic drift. Drift consists of small changes or like mutations in the genes of the influenza viruses that can lead to changes in the surface proteins of the virus. Antigenic drift is an important reason why people can get flu multiple times over the course of their lives. And also, antigenic drift is also a primary reason why the composition of flu vaccines is reviewed and updated annually. The other way influenza virus can change is called antigenic shift, which is an abrupt or major change in an influenza virus, resulting in creating a novel or new virus that infects humans. An example of a shift is when a flu virus from an animal gains the ability to infect humans. So while flu viruses evolve genetically all the time and often undergo antigenic drift, and antigenic shift happens infrequently. Next slide, please. So every year, seasonal influenza vaccines are developed in response to year-to-year changes of the influenza virus. So as I've mentioned, the evolution of influenza viruses is the primary reason why the composition of flu vaccines changes every season. So the possibility of antigenic drift requires seasonal influenza vaccines to be reformulated annually. And this is based on the global surveillance observations that and the WHO establishes which virus components to include in the vaccine. Influenza vaccines are therefore based on the best predictions for the upcoming influenza season, and efficacy can vary year to year. Several influenza strains can be included in a vaccine. For trivalent, it includes 3 strains, and quadrivalent includes 4 strains. Next slide, please. So for the 2024-2025 influenza season, we do have the trivalent influenza vaccine. On March 5, 2024, the FDA's Vaccine and Related Biological Products Advisory Committee, or VRBPAC, recommended that all U.S. influenza vaccines will be trivalent, or 3 components, for the 2024-2025 season. Trivalent flu vaccines protect against 3 different influenza viruses and will include vaccine viruses or viral proteins from 1 influenza A H1N1 virus, 1 influenza A H3N2 virus, and 1 influenza B Victoria lineage virus. So why are we transitioning from quadrivalent to trivalent flu vaccine? So the influenza B Yamagata vaccine component in flu vaccines is being removed because influenza B Yamagata viruses have not been detected after March 2020. Using the global surveillance for actively circulating influenza viruses. So the inclusion of B Yamagata antigen is no longer warranted at this time. So for frequently asked questions regarding the U.S. transition to trivalent influenza vaccines, you can refer to this link below. Next slide, please. So the updated 2024-2025 flu vaccine recommendation. CDC recommends everyone 6 months of age and older, with rare exceptions, to receive an updated 2024-2025 flu vaccine to reduce the risk of influenza and its potentially serious complications this fall and winter. CDC encourages providers to begin their influenza vaccination planning efforts now and to vaccinate patients as indicated once the 2024-25 influenza vaccines become available. Next slide, please. So what are the available vaccines through the Hawaii VFC program? So for the inactivated influenza vaccine, we do have the Flulaval, Fluzone, and Flucelvax. All are indicated for 6 months through 18 years of age. And the live attenuated influenza vaccine, which is the FluMist, is indicated for 2 years and to 18 years old. Next slide, please. So how do you order influenza vaccine? So it must be ordered using the seasonal influenza vaccine order form for 2024-25 and submitted to Hawaii, the VFC at doh.hawaii.gov. Online ordering through HIR is unavailable due to monitoring of allocation. Next slide, please. Hawaii VFC pre-booking for the 2024-2025 influenza season began on July 1st, 2024. So please consider the following information when determining your flu pre-book order amounts. Providers are encouraged to place orders for the full amount of VFC inactivated influenza vaccine and live attenuated influenza vaccine required by your practice for the 2024-25 flu season. So you have to order for the entire season. The inactivated influenza vaccine may only be administered to VFC eligible patients aged 6 months to 18 years, and the live attenuated influenza vaccine may only be administered to VFC eligible patients aged 2 years to 18 years. And priority will be given to providers that place their VFC influenza pre-book order by July 31st. Pre-book information has been distributed to VFC providers, and please refer to the email titled 2024-25 VFC Influenza Pre-book for the VFC pre-book form and instructions. And if you haven't received any emails about it, you could just email us at Hawaii VFC at doh.hawaii.gov. Next slide, please. Information about the expired influenza vaccine at the end of the season. So expired VFC influenza vaccine should be returned in the same manner as all other VFC vaccines. You would have to complete the vaccine loss reporting form to initiate the return of the expired flu vaccines to the vaccine distributor. And you should submit it to Hawaii VFC at doh.hawaii.gov. Completed forms must be submitted to the Hawaii VFC program no later than December 1st, 2024. And again, returns or processing for expired vaccines for influenza is not available through HIR, so you have to use the form and submit it to us. Please refer to this link for VFC vaccine return instructions. Next slide, please. Influenza vaccine borrowing. So borrowing should only be one directional for seasonal flu vaccine. Providers may use private stock for VFC eligible children and replace it when VFC vaccine becomes available. And please submit the completed vaccine borrowing report form to our email address. Providers should not use VFC flu vaccines for private stock due to limited allocation. Next slide, please. Yeah, and that's it for my presentation today. For contact information for VFC vaccine orders, you may contact people in here with their email address and phone number. And for VFC program and VFC site visits, information about the QA team is here as well. For HIR technical or login issues, please contact Registry Help Desk at this number or email them at registryhelp@doh.hawaii.gov. Next slide, please. So yeah, thank you for joining us today. We do have a post-webinar satisfaction survey, and the link, you could just click the link, yeah, we hope you enjoy the rest of your day. Oh, in the survey, we ask you to let us know what other topics you want us to talk about, or if you have a preferred date or time, and how we could improve. Yeah, we would really appreciate it. If you have any questions, just let us know. Just email us in our VFC email address. Thank you.